This is our spinal decompression table. It is the DTS Chattanooga Triton system. It's one of the most advanced tables on the market today. What you'll notice is two belts that harness to the hips and a breakaway table that allows for separation. When we're dealing with the spine, we're dealing with the lower back, middle back, and neck. Depending on the angle of the table, I can lower the table or I can raise the table depending on the level that I'm trying to decompress. Now remember that traction is considered the treatment, like an inversion table. The outcome is decompression. What happens with traction is that the spine is pulled apart, but there's a lot of muscle guarding. There is no steps or pounds of pull. It's one consistent long traction. Decompression is emphasizing a step-by-step process in a very specific protocol in order to open up the spine. Many patients with notable disc bulges or herniations have responded extremely well with the Chattanooga table. In fact, one of our most recent cases had an MRI showing a tremendous disc bulge. After 20 treatments, the radiologist called our office and said, "What are you doing to this patient? The disc had completely reabsorbed itself." And we told her that all we had been doing is using the decompression with our protocols. She was amazed, and in fact, she wrote us a letter congratulating us of the success story. One of the reasons why the DTS Triton head is so effective is that the computerized traction head allows for pre-programmed patterns for ramping up and down the amount of traction. This eliminates muscle guarding and permits decompression to occur at the disc level that we choose. There's two ways that we decompress the spine. One is through the cervical spine and the other one is through the lower back. And in this case, we have our patient comfortably supported with her knees with our blocks. We have our lower pelvic strap, which is designed to gently harness the lower pelvis for traction, laying it securely over the pelvis but comfortable. The second part will be to use our quick release belting systems. And gently snugging the belt into place. The second belt is used to secure the upper body, and I gently bring the belt in a cross pattern, making sure the patient is comfortable. The next step will be to use our DTS traction head with our rope. We clip into our belt. Primarily, our design here is to decompress the lower spine. I can use this table in a variety of different ways. I can raise it up or I can lower the table depending on the level that I would like to decompress. So as I lower the table, the rope angle steepens and we're distracting and decompressing the lower lumbar, the L4, L5. As I raise the table up, I'm affecting more of the L1, 2, and 3 levels, but again, the entire lower lumbar spine will be decompressed to a certain extent. Now that our patient is set up properly, I've input the amounts of pull, the rope angle, the speed of pull. I've unlocked the table. She's comfortable. We simply hit our start button, and the treatment time will be 20 to 25 minutes. In this scenario, we're doing cervical spinal decompression.